Is horrible. And even at his worst time, after being stabbed in the leg, he still needed to get his fix.
You can't legally do that.
Ambulance service, is the patient breathing?
Yeah, I'm not with him at the moment. The person has been stabbed.
Okay, so where's he been stabbed?
He's fine.
And do you know where the individual is that stabbed him?
He's left the building. But he isn't of sound mind, he isn't, so...
Right, okay.
827, thank you. Could we start you for 7?
Yeah, what was he?
As the alleged attacker is on the loose, it's unsafe for Matt and Chris to treat the victim before the operations manager and the police arrive.
On the in-cab computer, it came up with a warning that the police were required. The reason is that there was a risk of weapons due to the patient being stabbed.
Police are here.
How did you fall over?
When did this happen?
About an hour ago.
About an hour ago. Yeah. Your mate's put this on for you. Sorry, mate. Sorry.
As well as a stab wound to the leg, the patient has a deep cut on his head.
No active bleeding at present. Cool. Quite a lot of swelling surrounding.
Yeah.
So we get a blood pressure.
Swelling around the wound could be a sign of internal bleeding.
The problem with a stab wound is it can drop your blood pressure and it can increase your respiratory rate because your heart's trying to pump more blood around the body.
Come on, stay with us. What's this on the floor here, darling?
I think they're the safety syringes that they use for safe injection.
Lying next to the patient, the operations manager finds needles used to inject drugs.
Did you just use? Was that brown that you just used?
Yeah.
Yeah.
Brown is a street name for heroin. One of the side effects of heroin is it can drop your blood pressure, it can drop your heart rate, and it can drop your breathing rate. Do you want to just check me a Narcan?
400 is it, yeah? Just the one.
Yes, 400, yeah, in date.
Sorry, dude.
Chris gives the patient Narcan, a drug which counteracts the effects of heroin.
So, sats up to 99, heart rate of 93, BP 12974.
In a matter of minutes, the patient has gone from being semi-conscious to fully alert.
You've got some pretty horrible injuries, buddy.
Sorry,
okay.
Let me just come to your arm.
Significant blood loss in these trials.
There is, isn't there? Yeah. Are you wanting to take some brown again?
Yeah.
Right.
I know what you're going to say.
With the amount of blood that you've lost, mate, you take some brown, it could kill you.
Good. It's very, very likely to stop you breathing.
It was shocking to see that he was preparing to take heroin again, especially after we'd just given him the drug to stop him from having a reaction to it. Unfortunately, addiction is horrible. And even at his worst time, after being stabbed in the leg, he still needed to get his fix.
The swift actions of Matt and Chris may have revived the patient, but with the effects of the heroin wearing off, he wants a new fix straight away.
Mate, don't.
Please.
No. I'm going to be firm with you. No.
Yeah, I better see.
Mate, you can't have
You
any more, bud.
can't. Not while we're here. No.
We can't let you do that, buddy.
No.
I think you can.
Mate, we're going to have to get the police to come and take it off you. You can't do that
You
because...
can't, mate. With all due respect, we need to get you to hospital, not wait for you to shoot off.
Unfortunately, because he was so determined on getting that fix, we needed the police to help us to stop him from doing it.
You can't. Do not stop. Listen. You can't legally do that. No. Listen, get the fuck. Let go. Get the fuck. For your profits, not ours. Get the fuck for yours. Get the fuck now. Please.
Minutes later, Matt and Chris arrive at Royal Stoke University Hospital,
Go, go, go.
where the trauma team will attempt to stem the bleeding while repairing the wound to his leg.
How often have you put a tourniquet on then?
Very rarely. That was my second ever.
Was that your second?
Second ever. I think he was losing quite a bit of blood into his leg, though.
He was. It ballooned, hadn't it?
Yeah.
I think what is sad though is that he's got quite a significant addiction, and
We're like at the worst point. He's been stabbed, but all his
still-
brain can think about is
Yeah.
getting